Marlena, you're in charge again?
Deputy Premier, just a moment.
Sure.
Too long, thank you. 4, 3, 2, 1.
Well, good morning, Queensland. We've just finished our daily COVID meeting, the Queensland Government daily COVID meeting chaired by the Premier, and we can report that there are 15 new cases of COVID-19 in Queensland. 2 of those are overseas acquired and detected in hotel quarantine. They were the last 2 crew members of the MV Sanya that had not been infected, so all of that crew have now been confirmed as positive. That means there's 13 new cases, all linked to the outbreak that we've been monitoring in recent days, bringing the total number of genomically linked cases to 31. 7 new cases are students from Ironside State School. 5 are related to Ironside State School, that's household members or family contacts, and 1 case is linked to a confirmed case from the karate school that trains at Ironside State School. That brings our total number of cases to 1,824, 66 of which are active. Very pleasingly, we did 21,806 tests yesterday, which is a very good result for a Sunday, and we'd want to thank every Queenslander who came forward to get tested, and of course all of our fantastic staff at the testing clinics. On Mondays, more clinics are open, and so I think yesterday I set the goal of doubling our numbers into the 20,000s, and the Chief Health Officer set the goal of double that again into the 40,000s. We would certainly hope that we can start to get close to those kinds of numbers on a Monday with more of those clinics open. Obviously, though, this result today is a further increase in the number of cases related to this outbreak. You'll recall we went from 1 on the first day, then 6, then 9, and now 13. So it's starting to become clear that the initial 3-day lockdown will be insufficient to deal with this outbreak. And so we're advising South East Queenslanders today in those 11 LGAs that the lockdown will be extended until 4 p.m. on Sunday. That will make it an 8-day lockdown. And we desperately hope that that will be sufficient for our contact tracers to get into home quarantine absolutely anyone who could have been exposed to the Delta strain. But for it to work, for us to come out of this at the weekend, we need absolutely everyone in those LGAs to stay at home if they possibly can. It is absolutely critical that people only leave their homes for those 4 reasons. There's too many cars on the road in Brisbane at the moment, too many people out and about. And if you absolutely have to leave your home, please make sure you wear a mask. Just because you worked in previous lockdowns doesn't mean you should work through this lockdown. Please consider if it is absolutely necessary for you to work, for you to leave your home. That means that home learning will be in place from Tuesday for the entire week for Queensland state schools, and private schools will largely also have similar arrangements. I want to thank teachers who are spending today getting those home learning lessons in place and ready for the rest of the week. I also want to thank the teachers and staff and principals of the now 6 schools affected by the outbreak. This is the first time that we've seen an outbreak like this one spreading in schools amongst students, teachers and parents, and via extracurricular activities and public transport. It will likely see thousands of people subject to home quarantine directions, and we thank those schools for working so closely with us. Clearly now, the lockdown extends beyond the intended start day of the ECA, and that means we've had to make the very regrettable decision to advise the ECA to cancel their event for this year. It will not be able to go ahead. I know that's sad and disappointing for many, many Queenslanders who love their annual ritual, their annual trip to the ECA. We just can't afford to have an event like that where people travel into town, circulate in large numbers. The risk is just too great. And so I want to thank the RNA for working so closely with us, and I'm sure the ECA, the event we love, will be back even bigger and better next year. The Treasurer in a moment will outline the details of our business assistance package, and I want to thank him and his team for working on that right through the weekend. Eligible businesses will receive a payment of $5,000 at an estimated cost of $260 million. That's on top of the worker compensation package that I was able to detail yesterday. And finally, this morning I've received a request from our supermarkets to send a message to Queenslanders that we are still seeing some panic buying, and there is no need for panic buying. Right throughout the recent lockdowns in Sydney and Melbourne, none of our supermarkets ran out of stock, and they will not here. So if you must go to the supermarket, please be respectful of the staff. Please make sure you have your mask with you. Please check in using the QR code, and please only buy what you need.
So yes, this outbreak unfortunately is escalating, but I am very confident that with the strategies we have in place in Queensland and with the cooperation of every single Queenslander, we will get through it. But to get through it by 4 p.m. on Sunday, when this current lockdown will end, I need every single person in Queensland, no matter where you are, to immediately come forward and get tested if you have any symptoms. And I need people in the 11 LGAs who are under this stay-at-home order to do just that, to stay at home. So we are mobilising support for people. If you are in quarantine, it is vital you absolutely adhere to that. Do not leave unless you need to get a test or it is an absolute dire emergency. If it isn't a dire emergency and you have got an issue, please ring 134 COVID, and we're increasing the numbers of staff who will be available to take your calls, and we will help sort out whatever your issue is. Don't leave home. We know that the Delta variant of the virus is totally unforgiving. It really and truly spreads so rapidly. Today, one of those 4 new cases are in one family. So we've got to that family and immediately all people in that household are positive. So this is critical. If you've been asked to go into quarantine, that means that you can't go out and do something else before you go into quarantine. Immediately go into quarantine. And then people who are at home, all of those 11 LGAs, please stay home unless you really and truly can't do your job from home. Would you please stay at home? That is so important. Stay at home, look after your kids, look after your family, and don't leave unless you need to buy true essentials. So you need to buy food, and we're not going to run out of food. Our supermarkets are absolutely fine. So only go when you need to buy that food. Don't go ahead of time. And when you go, wear a mask. We have seen that masks really work, particularly with this Delta variant. So please wear a mask. If you can't wear a mask, please don't leave your home. That's when you ring 134 COVID and get assistance. So we're already mobilising. The supermarkets have been brilliant. We're looking at online shopping, online processes. If you can use that, please do that. Just stay home. We know that you need a person to move this virus. So if everyone stays home, we won't be moving the virus around. Now, I am asking for people outside Brisbane to also make sure they get tested, so people outside the southeast corner, because I don't know where this virus has already moved to. So just because you live outside one of those 11 LGAs, don't feel comfortable. Make sure if you've got any symptoms, you come forward and get tested. And please, if you're due for a vaccine, go and get it. If you're due for your second dose, unless you're in quarantine, ring up and get advice. Go and get a vaccine. If you're 60 years of age or over, go and get the AstraZeneca from your GP or a pharmacy or wherever it's available. Thank you.
So thank you to all of those people in Queensland who came out and got tested yesterday. An increase of over 10,000 from Saturday is great, but we want to see those numbers continue to grow. We know testing and staying at home will save lives. We've seen 2 people in New South Wales who have died at home because they have not gone and got tested for COVID. They died in their homes from COVID. So please, if you have any symptoms, what we know is that the Delta variant in Queensland is leading to a higher rate of hospitalisation than New South Wales. So we need you to take this seriously. If you are unwell, even with the most mild of symptoms, then you must come and get tested wherever you are in Queensland. Today we have around 64 drive-through clinics across Queensland, and in the greater Brisbane and Sunshine Coast area we have 33 drive-through clinics operating today, as well as our walk-in clinics, plus there is the Commonwealth testing clinics where you don't need an appointment. And overnight we've reached agreement with private pathologists who previously would require a referral, that you no longer need a referral to go to those private pathologists who are in the 11 local government areas, and this will be the case until Friday the 6th of August. Until midnight Friday the 6th of August, you'll be able to go to those private pathologists without a referral. It's really important people come and get tested and then stay home. When we say essential workers or essential shopping, we mean essential. This is a message to employers. Does your staff really need to be coming into work? Do they need to be coming into the office? Can they be working from home? If the answer is yes, then that's where they should be. The obligation is as much as employers as it is the individual workers to ensure that their staff are staying home unless it's absolutely essential, and that goes for shopping as well. So retail shopping is not essential. Food shopping is, but only go out when you really need to go shopping and getting your groceries. So we need people looking at the roadmap. Please don't just rely on what you know have been the lockdown rules previously. This lockdown is harder for a good reason. We're trying to save lives. So the number of people you're allowed in your household, which is 0, where you can go, what you can do, the rules are stricter this time. So please don't rely on what you've known in the past about number of gatherings and being outdoors and mask wearing. Look up the roadmap, go to the Queensland COVID website, look at our social media, and of course keep checking for exposure sites across the 11 LGAs or anywhere in Queensland. Check for exposure sites on a regular basis, multiple times a day. And of course, check our website and social media for any testing clinics as well. And as Dr. Young has said, if you have a booking for a vaccination, make sure you go and get that vaccination. If you haven't booked in for your GP yet and you are eligible to go to your GP and get your vaccination, please do so as soon as possible.
I'll start with thanking the vast majority of our community that are doing the right thing through this very difficult time, but unfortunately I do have to focus on those that are doing the wrong thing. It's quite regrettable for us that we have to be out policing a protest this morning when we're in lockdown. My message to those people that are tying up hundreds of police that could be doing other things is go home. Now is not the time to protest. Put the interests of your community's safety ahead of your own views. We also had to hand out 205 masks yesterday. The message is really clear. Carry your mask with you and wear it when you should. We responded to 116 calls for service where our community is concerned about the behaviour of people. That stretches our resources, so we need you to do the right thing. In the last 24 hours, we issued 29 penalty infringement notices, 18 of which were people who were out of lockdown when they had no valid reason. We had another 2 breaches of restrictions within homes, so unauthorised party type of scenario. One person refusing to wear a mask when they didn't, a couple of border breaches, 3 persons disobeying a direct direction from an emergency officer, so that's a police officer, and 3 breaches of public health directions. Now, what is disappointing about all of those, in every single case people are given the opportunity to comply. They choose not to, and we're left with no option but to take action. In a further 2 cases, we had to arrest people because of the nature of the event. The plea there for all of our community who are doing the right thing, for those that think that what they want to do is more important than the broader community, wake up to yourself. Think about that, please. Thank you.
Dr. Young, sorry, Treasurer, I think you're going to go later.
Won't be too long. Throughout the pandemic, Queensland has demonstrated one fundamental truth. When we act decisively, when we act fast, we get the best results. That's been the case with our health response to COVID-19. It's also been the case with our economic response to COVID-19. But now we're dealing with a different enemy, and that enemy is called Delta. The Delta variant is dangerous, the Delta variant is dire, but most importantly, the Delta variant is deadly. Previously, we've seen Queenslanders respond to business out of short, fast lockdowns, and we've seen retail trade activity and consumer spending bounce back significantly after short lockdowns. But now we've had 2 lockdowns in the space of 1 month, and that just hasn't allowed Queensland businesses to be able to recover from the impact of the first lockdown. So today I'm announcing a $260 million package to support Queensland businesses, particularly small and medium-sized enterprises. We'll be opening a 2021 COVID business support grant program. That'll be $5,000 grants available to Queensland businesses, not just businesses in the lockdown area. That'll be available to all Queensland businesses, and that recognises the impact that the Delta variant has had on those businesses, because it stopped the visitors, it stopped the tourists coming from other parts of the country who are also in lockdown. So those grants will be available to Queensland businesses. In the lockdown area, in the 11 local government areas, we'll also be ensuring those grants are available to large businesses who operate in the hospitality and tourism space. They will be supported through these grants as well. So every lockdown is different, and every lockdown requires a different response at multiple levels from government, but this is an important step. And these businesses, of course, are employing businesses. These are businesses that employ people, and that allows us to provide some cash flow support so those businesses can continue to operate. We're also calling on councils to look at how they can help businesses. The federal government's dug deep, the state government's dug deep, we've gone into deficit and borrowed to help. We're looking to councils now to do their bit to help businesses in their affected local government areas as well. In conclusion, can I just say to businesses across Queensland, thank you for your strength and resilience. You have been terrific, you've been fantastic during the pandemic, you've kept businesses going, you've kept our economy going, and now we're providing some support to you. If we obey the health advice, if we follow the health advice, we can get through this lockdown and get back open and trading as quickly as possible, and that's the objective of the government.
Dr. Young, have you yet found the missing link between the Sunshine Coast return satellite and the medical system?
No, I haven't found the missing link, but I do have more genome sequence results. Another 9 came through overnight, and they're all clustering with those initial 2. So the gentleman who travelled from Indonesia, and the person who travelled from the UK, and the 17-year-old who was the first person in the household who we tested positive. So now I'm very confident that the medical student did not take the virus into that household with 5 people in it, where the 17-year-old was. One of that household gave it to the medical student. So I don't know where the missing link is. All I know is we had 2 people arrive from overseas into the Brisbane International Airport on the 29th of June, and subsequently those 2 people were found to have the Delta variant with a particular whole genome sequence, and now this outbreak, 29 additional people later, are all clustering with those 2. But I don't know how it's got from those 2 original people to this household of 5 who are the first people that I've found in the cluster. I do have PCR, so acute swab results from the family of that gentleman who was managed up in the Sunshine Coast and went home to Budrin. It doesn't look like he spread it to the family. We've got to get some additional tests. The initial serology is suggestive that he did not, so I don't think that's the avenue of spread. So I genuinely don't know how it's got from those 2 people who came into Queensland on the 29th of June, and now we've seen this outbreak.
Given what's happening in the community, cases to come between now and Sunday?
Yes, of course I do. So a lot of additional cases. That's why it's so important we get people tested as soon as possible and that everyone follows those stay-at-home orders, because we are going to see a lot more exposure venues. Just for example, one of those cases that I've announced today had been in the community for 6 days while infectious before they were placed into quarantine. So there will be a lot of exposure venues. Those exposure venues will decrease as people are staying at home and aren't out there being exposed. So please just don't leave your own home for your own sake unless you absolutely have to. That's critical, because you can't get exposed to the virus if you're not coming across someone who has it. And we don't know the people who have it at this stage.
How hopeful or realistic is it that the lockdown might be lifted at 4 o'clock on Sunday?
Let me see what happens over the next few days. So it's been extended for another 6 days to give us a chance to get on top of all of those current people who've been exposed, and we'll soon know within the next few days where we're tracking.
Dr. Mel, can you explain what's happening in Rockhampton? A lot of concerned families there, particularly with that nuclear site.
Yes.
And I think there was a school that was affected as well.
Yes. So yes, there was someone who went from Brisbane, an essential worker, up to Rockhampton and were there for 3 days, but there hasn't at this stage been a transmission event. So it's really important that anyone in Rockhampton with any symptoms just comes forward and gets tested. And similarly, the school went to the Weir, but I don't know that there was any direct crossover. But look, we know that Delta can transmit within seconds. So the thing is to be as cautious as you possibly can. Anyone in Rockhampton with any symptoms, please just get tested. Don't think it might be something else, hay fever or anything else. Just get tested.
Given the current situation, Dr. Young, do you think people under the age of 60 should get AstraZeneca if it's immediately available?
That's something that everyone should consider, and of course should, as the advice from ATAGI has said now, should go and talk that through with their doctor. Anyone, and I am still concerned, there are still people over the age of 60 years or over, who haven't had their vaccine. So anyone who is 60 years of age or older, if you haven't had your AstraZeneca vaccine, unless your GP says you're one of that tiny group that shouldn't get it, then please go to your GP and get vaccinated, because we know that people over 60, and in Queensland our 7 deaths to date have all been since the start of the pandemic, have all been in people well over the age of 60. So please, if you are 60 years of age or older, go immediately and get your first dose of AstraZeneca. And if you're due for your second dose, and it's been more than 8 weeks since your first dose, go and get your second dose.
Has your view on under 60s changed given the higher risk now in the community?
I think it's important that people have that discussion with their GPs. That is the advice from ATAGI. If you are under 60 and you feel particularly concerned, go and talk to your GP about whether or not you should be having a dose of AstraZeneca. So I will be going and seeing my GP to have my second dose earlier. I wasn't due till the 31st of August. I will be going and getting my second dose of AstraZeneca earlier.
Are you giving any consideration to your 12 students getting vaccinated, like in New South Wales?
Sorry?
Are you giving any consideration to your 12 students getting vaccinated, like in New South Wales?
No, not at this stage. At this stage, I want the people who are most at risk of spreading the virus to continue to get vaccinated with Pfizer. So I want every single aged care worker who isn't already vaccinated. You should be. It's mandatory by September, but I want you to get vaccinated now. So any aged care worker who hasn't been vaccinated, you have to come forward and get vaccinated. In New South Wales today, we've seen more cases in a nursing home. Please, it is so important. I want any healthcare worker anywhere in the state. We're at around 80% of healthcare workers, frontline healthcare workers now vaccinated. I need 100% of our healthcare workers to be vaccinated, because we are going to be, no matter how effective we are in the next 6 days, we are going to be treating more people with COVID. You need to be vaccinated, but not only for your own sake, but I don't want you to then leave work and spread the virus to your own family or to other people in the community. We need to really push this. Then I need people in our hotels who are managing quarantine cases. You have been just brilliant. You really and truly have. Our hotels have been the backbone of our response and have done a fantastic job. If there's anyone left, I don't think there is actually, but if there's anyone left there who hasn't been vaccinated, they must be vaccinated. And similarly at the airport. That is the way we will keep most Queenslanders safe if we stop this virus continuing to come into our state.
Are there any exposure sites you're particularly concerned about?
The schools. I really am very, very concerned about these 6 schools. We know Delta is much more likely to spread amongst younger people. So in previous outbreaks, we've known that younger people have been spared, but Delta has a closer affinity to respiratory cells, and we know younger people are more at risk. And although they're less likely to do particularly badly if they get infected, they're less likely to die, they are more likely to transmit to other people. So I am very worried about those 6 schools. So although it's destroying our health workforce numbers, because a lot of health workers have children going to those 6 schools, and now those health workers are in quarantine with their children, they're not at work, I need that to happen because I cannot have those health workers going into the workplace and spreading the virus.
Possible vaccinated asymptomatic person could have been that missing link between.
Yeah, it could be possible, yes, it could be.
And do you know, of the 31 cases, do you know how many are kids?
The majority are kids.
Just on the surgeons, for example, being told to home isolate if they're linked with the schools, are you concerned by that backlog with surgeries now? If we've got surgeons in home isolation, is there...
Yeah, I'm very, very concerned. So we are doing the work now to look at the impact of all of that health workforce being at home. Now, hopefully they're only at home for 14 days, and then we can get back and we can ramp up elective surgery and outpatients again. But I have spoken to our hospitals, and I know our Director General has spoken to our hospitals to look at what is the critical work that needs to continue and what work can just be deferred for the next week.
We've had a mum from Ironside State School, her 7-year-old son tried to go to Brisbane Hospital. He's been transferred to the Gold Coast because they said Brisbane Hospital is full. So Brisbane Hospital is full of COVID patients?
We currently have 4 hospitals that can safely manage COVID cases. We're looking at how we can urgently ramp that up. But at the moment, our 4 hospitals are Prince Charles Hospital, Royal Brisbane and Women's Hospital, Gold Coast Hospital and Sunshine Coast Hospital. They have the environment and they have the expertise. And if it was me, I would be very grateful if I got admitted to any one of those 4 hospitals. That is far better than going to one of the other hospitals, but we will have to ramp up other hospitals. The other hospital, but I am keeping that for when the children become very unwell, is our children's hospital. It also has developed a lot of expertise at treating COVID. So look, I'm sorry that people have to travel an hour and a half down to the Gold Coast to be admitted down there, but can I say that the Gold Coast Hospital is one of our best hospitals for treating COVID. It actually had a ward built after the last SARS pandemic that happened in Asia, if you remember. It built a ward for exactly this situation. It's probably our best setup in the state. So I'd be very happy to be admitted to the Gold Coast myself.
Is it concerning though that we're not even halfway through this pandemic lockdown extended to Sunday and maybe COVID hospitals are filling up with COVID patients?
Yes, of course it's concerning. That's why I'm saying we need to lock down really, really hard, the hardest we've ever locked down. This is genuinely, if you don't need to leave your house, don't. It is really, really, really important. And I cannot understand why anyone would be in an office today. If you are in an office today, why aren't you at home? There are far too many cars out on the road when I drove in this morning. So please, so that we can make sure that we provide 100% the best possible care we can, I need fewer people with COVID. so we can continue to provide that care. A very astute comment. Thank you.
On the testing front, obviously there were massive lines yesterday, up to 5 hours. People were losing their places in the queue because they had to go to the toilet. And I understand some changes have been brought in today,
Yes.
but so many places were closed yesterday. Is the government, and I'm not sure if it's a question for someone else, are they doing it? Are we going to extend clinic
of
hours?
course.
They're going to be opening. Can you tell us more about that?
Yeah. So we're extending all of our clinics to the times that they can be managed. We're getting extra workforce in. We're working very, very closely with the private sector. Can I say I'm so glad our private sector in Queensland in pathology is one of the best in the country, if not in the world, and they are standing up. They do cut back on weekends because they've got workforce issues as well, but they'll be ramping up readily today. So the fact yesterday that we doubled our numbers and we ended up with 5-hour queues, that will be brought back in control today. And I thank every single person who went and queued for those 5 hours. Thank you very, very much.
Dr. Young, on the
Just
health.
confirm the rules for the construction industry?
Yep. So construction can occur where it is commercial construction, or it is, for instance, building a house and there's no one living there. That can continue at this point in time, and I want to congratulate the construction industry in Queensland. They have worked with me every single day, right from the start when we had outbreaks, to make sure that we wouldn't get outbreaks in the construction industry, and we've not seen them. I do not want the construction industry continuing to work where there are people living in that house, because those people are required to stay home. So there's a risk there. So unless that is essential work, so sometimes you're building something and you can't just pause for a week. You just can't. You're at a critical point of having a roof or a ceiling or something's happening. That needs to continue. But if it's not critical and it can be paused for a week, then please pause it. And the other reason, of course, if you've got a burst pipe or something like that's happened, or your electricity, then that's critical. So I know the construction industry is extraordinarily sensible. They will know what is critical, what is essential. That needs to continue. And I know that the commercial sites have got some really good workplace health and safety processes in place, so that can continue. But for domestic homes, unless you're building a new house from scratch, of course, that I would regard as commercial. But if you're going into someone's home, then no, please don't do that.
Dr. Young, have we had to ask for any contact tracing help from other states at all at this stage?
No, we have got a lot of contact tracers. I have asked this morning from my colleagues from other government agencies to release the staff that they released to us last year. We had a lot of staff from a lot of different agencies providing support to health last year. I want those same people, because they're already trained, they know what they're doing, to come back, plus more, and they've immediately responded. So we have a joined up government here in Queensland, and we all work together and support each other.
How many health workers do you estimate are affected by
I'm getting that number. I hadn't received it prior to coming to this press
And
conference.
just on the children, so the majority of cases...
I believe so, but we'll be able to give you that exact breakdown of all of the cases. But I can give you this morning's, if that is useful to people. So 10 are in the 0 to 9 age group, 1 in the 10 to 19, 1 in the 20 to 29, and 3 in the 30 to 39. That's today's numbers.
But Young, there's been texted by someone who said there's construction work taking place at Ipswich Hospital today.
Yes.
Is that something that should be continued?
Yes, absolutely. We need our hospitals to have that work, and of course a hospital more than anywhere understands about the infection control and the separation. But we have to continue ramping up our hospitals able to take on additional cases.
Yeah.
If this doesn't end on Sunday, we have to be prepared. I hope. And look, I'm pretty confident with the response I've always had from Queenslanders that we'll be able to get this under control by Sunday, but I always plan for the next stage. You don't employ me to just think about what's happening today. You employ me as Queenslanders to think about what's going to happen in a month's time or 6 months' time, and that's what I'm doing.
Just on the AstraZeneca, in hindsight, was it a mistake to be so unequivocal and say I don't want under 40s to get the AstraZeneca, given the changing risk factors now?
No.
Issues with hesitancy? Should you have been so hardline about it, or really just reflecting
No,
the target?
I've been very, very clear, and I remain clear. And what worries me is if you are 60 years of age or over and you haven't had an AstraZeneca vaccine, and I've always been crystal clear, they are the people most at risk. Yep.
Talking about the younger people,
Yep.
because you were very firm on
Yep,
that.
and I remain firm. They need to, as per the ATAGI advice and the TGA advice, and advice if you look around the world, they need to, if they think they have a particular risk, immediately go and talk to their own doctor. I said I didn't want 18-year-olds to have AstraZeneca, and I still don't.
Even now, with the risk factors?
Even now, yes.
So what age should they get AstraZeneca?
60. Please, I don't know how I can be clearer than this. If you are 60 years of age or older, go and get your first dose of AstraZeneca if you haven't had it already. And if it is 8 weeks since that first dose, go and get your second dose. That's what I'm organising today. I want anyone who has had their first dose of AstraZeneca, if it is more than 8 weeks since you had that, go and get your second dose. And the Commonwealth, I rang them this morning, the Commonwealth is standing up more pharmacies all through southeast Queensland to be able to administer AstraZeneca. Not sure if that'll be in place today, but it'll be in place in the coming days. So you can go to a pharmacy for your second dose, or you can go to your GP or one of the clinics that the Commonwealth has in place. I've got a number, but it's many, many, many more than that number. The data is catching up, so it'll be thousands and thousands.
Would it be over 10,000?
I don't think it'll be over 10,000 in home quarantine. All up, yes, I think it'll be over 10,000.
I just ask you, I think you said this morning you may not abide by the National Cabinet vaccination plan or the targets. What is the target to come out of lockdown in your view of Queensland government?
That's not exactly what I said. I just indicated that roadmaps have been very useful throughout this pandemic. We support the roadmap that came out of National Cabinet. But as always, the decisions that will be made at that point in time will be based on the facts at that point in time. The rate of vaccination will be one of them. The nature of an outbreak and the strain of that outbreak will also need to be considered.
So there's no sort of set target in your view, it's just independent of that discussion?
Well, look, I'll take the health advice. Those thresholds seem sensible to me at the point at which you could start to take those vaccination rates into account when determining what other restrictions need to be put in place to stop an outbreak.
We asked the Treasurer a question.
Sorry, are elective surgeries being cancelled? Is it non-urgent elective surgery?
I understand some of our hospitals will be rescheduling some Category 2 and 3 elective surgeries as well as specialist outpatient appointments. They'll be determining the level of critical services that can be supported with their workforce and then making assessments about less urgent activity.
Treasurer, just on that, the grants. I spoke to a small business owner this morning who runs a cafe, and she said she's making decisions, as they all are, about whether she pays a rent or a wage this week. Given that, how soon will they be able to access this money? When will it be in their bank accounts?
So we need to set up the process for the applications to be considered and dealt with by government. We're looking to set up the processing administrative process for this within 2 weeks. That would be twice as fast as New South Wales. New South Wales spent 4 weeks setting up their processes. We've looked at that very carefully inside government, and we aim to get the application process going within 2 weeks. In a fortnight we'll have to put a regulation through to allow the payments to be made as well, but we're getting on with the job. We're going to do this as quickly as possible.
A lot of small businesses say they may not be able to survive 2 weeks. Is there any way it could be done faster?
We will work as hard as we can, but we'll be working twice as fast as New South Wales, and we'll be getting the money out as quickly as we can.
And how will they get it now? How will it be distributed?
It'll be an online application process, as we've done previously with our grants. We had a very significant small business grant process in our COVID recovery package last year. Part of the $14.2 billion we've already provided to Queensland individuals, families and households and businesses. So we'll be getting that out through bank accounts. So they'll lodge an electronic application through the Department of Employment, Small Business and Training. That'll be processed quickly and we'll turn that money out as quickly as we can. But we'll have a lot of applications. It will take time to get the money out, but it will be on par or faster than other parts of the country.
Will the government make more money available for the next lockdown if extended further?
Well, there's agreed processes with the federal government now, and I thank the federal government for triggering the COVID disaster recovery payments that they've activated, and there's an established process agreed by National Cabinet about ongoing payments. For the time being, this is what we'll be doing, and if those other triggers are met, we will of course be paying more under that nationally agreed arrangement.
If the 260 million isn't enough, there's too many businesses applying for it, will some businesses miss out, or will there be more money out of it?
No, we anticipate that will be sufficient funding on the analysis we've done to this point, but anyone who makes application will receive that funding.
Okay.
Thanks
very much.
Are you talking educationalist?
If you need Grace,
Yeah, that would be, if you're available, that'd be great. Yeah.